Good morning, Dr. Erickson and team. This is Justin from Alastin. Just wanted to send you a quick video kind of recapping everything we discussed yesterday. I hope everyone learned something or refreshed something in their minds about Alastin. I'm always here if you guys need anything. You can email me, give me a call. I'm willing to stop by anytime, just let me know. But I wanted just to start off by thanking you for letting me come in yesterday. I had a good time, and hopefully everyone learned something new. So first is the Trihex technology, which is the foundation of Alastin skincare. And Trihex technology is peptides that are penetrated into the skin. It stimulates collagen elastin, as well as those enzymes to clear out that debris, all the broken collagen and elastin, to make room for the new stuff that's going to be regenerated. So it gets the skin to a healthier state. Everything that is appearing on the outside, the wrinkles, fine lines, pigmentation, dull looking skin, everything within is actually causing that. So once we clean out that debris, stimulate that collagen and elastin, and keep that cycle going, gives the skin a much healthier look, and patients can handle treatments better because that skin is at a healthier state. So Trihex technology, foundation of Alastin. We discussed the invasive kits, which I provided those handouts to you. Use them at your will. You can edit them and make them your own. I can aid in kind of formatting what we have and putting your information in there. However you like to use them. If you have any questions about them, let me know again. But I think that was a good outline of steps to give to your patients, so that way we try to make sure they are compliant as possible and getting the optimal outcome. We discussed the restorative skin and how it differs from the nectar. So with the nectar, using it 2 weeks prior to an ablative procedure, and following up, obviously using it immediately post until it's gone, aids the skin in reducing inflammation, swelling, and gives that patient a better understanding of minimal downtime, and the outcomes, the results will be reflected sooner. So the restorative skin focuses on hydration, volumizing or plumping, and pigmentation. So nectar doesn't have any hydrating components to it. It's strictly for pre and post use, and still has the Trihex technology. But as soon as they're finished with that nectar, they should be transitioning into the restorative. So again, hydration, volumizing, plumping, and pigmentation is restorative skin complex. The restorative eye, which I put on today here, focuses on puffiness, dark circles, and elasticity of the eyelid. So again, has Trihex technology, so it's going to stimulate collagen elastin around the eye. It's going to help the elasticity of the lids a bit, and also with the puffiness and dark circles. So that's a great add-on to patients who are doing anything orbitally, including injectables, neurotoxins. It helps with those fine lines and wrinkles that obviously the muscle is going to minimize movement, or the neurotoxin is going to minimize the movement, but still doesn't address the skin, the superficial, that people tend to focus on the most. And then we have the restorative neck treatment. That treatment again has Trihex technology. It hydrates because we have limited sebaceous glands here, so it tends to get a little bit dry, especially because people don't protect the neck and chest as much with the SPF, so you kind of see that more with the crepiness and pigmentation. So it hydrates, addresses pigmentation, the reds and browns, and also their crepiness and elasticity. So it's a great product to incorporate into your BBLs or photofacial type areas, just to kind of help with that process of reducing the pigmentation, and also again hydrating. The Hydra Tint, which we all talked about, is a phenomenal product. Women love it for makeup foundation. The tint is great. It's for all skin types. It has antioxidants that help to protect the collagen elastin that's being restimulated. Remember, the enzyme MMP1 actually attacks healthy skin or healthy collagen. So the SPF has kind of helped minimizing that sun to penetrate through, and minimizing that MMP enzyme that's going to come through and attack those. So it's a great product, and it's not a chemical SPF, which we had talked about yesterday. A lot of people don't want to utilize that. And then lastly, The transform body treatment, which we talked about, stimulates the autophagy process, getting those lysosomes and those macrophages to attack, I guess, or break down that damaged fat cell sooner, so patients see a result quicker. It also helps with the appearance of crepiness and elasticity. So those three benefits for patients utilizing a fat reduction process, but also as a standalone product, they're seeing a lot of reduction in the crepiness and the elasticity. So it's a great product too. So those were the key things that I thought were prevalent to our conversation yesterday. If there's any other questions, like I mentioned, feel free to reach out to me. But I enjoyed meeting everybody, and I look forward to continuing to work with you. So have a great Friday, great weekend, and I'll talk to everybody soon. Take care.